Hello, welcome. This is Outside Source on BBC News for viewers in the UK and around the world. We are, of course, covering all the very latest coronavirus developments here in Britain and also globally. Thank you for joining us. It is just after 8 o'clock in the evening here in the UK. It's Thursday, which once again means that people across the country are at their windows, front doors, even in the street, as you can see, applauding all those key workers who are working tirelessly to overcome COVID-19. We have cameras across the country. This is currently the image that we're seeing live from Sunderland, where, well, you can see that people are, nuns included, getting ready to celebrate the commitments and the efforts of our key workers who are doing everything that they can to help us get through this difficult period. We're in Belfast now, as you can see, the rainbow becoming the symbol of appreciation for the NHS. The clap for our carers, a bit of a tradition now, every Thursday evening during this lockdown period. The UK, of course, in its fifth week of lockdown. It was introduced on the 23rd of March. People coming together at 8 o'clock in the evening and not necessarily just clapping, also enjoying themselves as well, which is lovely because, of course, there is a lockdown and only essential journeys are allowed. So people very much are staying within their homes in order to support the NHS, in order to save lives. So the traditional clap for carers that's taking place at 8 o'clock on a Thursday evening, taking place here in the UK. Well, this is happening as the UK government has reported another 616 coronavirus deaths in hospital. So this now brings the total to 18,738. That does not include deaths in care homes or in the community. In the daily press conference, the Health Secretary also announced an expansion of testing and tracing people with coronavirus. Essential workers and people who live with them will now be able to be tested. Let's hear from Matt Hancock.
We can make it easier, faster and simpler for any essential worker in England who needs a test to get a test. From today, employers of essential workers who will be able to go on gov.uk to get a test for any of their staff.
Well, the government has set a target of 100,000 tests a day they aim to reach by the end of this month. So let's have a look at how it's delivering. Now, this graph shows the capacity to test has increased to 51,000 per day. Mr. Hancock says that it's on track to reach that 100,000 target. But while the capacity is up, only just over 23,500 tests, in fact, took place yesterday. So as you can see, there is still some way to go. Now, the government is also hiring 18,000 people and developing an app to help tracing infections. But Mr. Hancock says that doesn't mean that there is a deadline for reducing the social distancing measures that are currently.
What I would say is that test, track and trace can, done effectively, can help to suppress the transmission in a way that allows you then to have lesser social distancing rules. And critically, test, track and trace works more effectively when the rate of new cases is lower. So the lower the rate of new cases, the more effectively you can keep it down using test, track and trace rather than having to use heavier social distancing measures.
So that was Matt Hancock there during the daily briefing that we have every day here in the UK. Our political correspondent Jessica Parker across this as well for us. So Jessica, the aim is to get those tests up to 100,000 a day. And one of the ways is by opening up the eligibility of those allowed to get tested.
Yeah, because I suppose there's two elements to this testing target, and it seems to me they're pretty confident in terms of reaching capacity. So as you've been reflecting, now at around 51,000 tests in terms of capacity, therefore the ability to carry out, the availability to carry out around 50,000 tests a day. But as you also mentioned, the actual numbers of tests being carried out. In reality, much lower than that, 23,560, the latest figures I have. So they seem like they can get to that 100,000 capacity figure, but of course they want to make sure that that capacity is being used, and that is what's behind, I think, trying to expand the eligibility of those who can take part in tests. Although I think ministers would say that they always intended to try and expand testing. The priority at first was patients in hospitals, then key workers, and now they're making it easier to allow key workers via their employers or key workers themselves from tomorrow to sign up and try and get a test. All to reach, I think, this target of 100,000 by the end of this month. And that was a target that Matt Hancock, the Health Secretary, set when the government was coming under quite a lot of pressure over its strategy when it came to testing. You'll remember, it's very well known now, when last month the WHO, the World Health Organization, said test, test, test. And it led to questions here and some criticism as to whether the government was doing enough. Now, the government said that it's been led by the science, that it has taken the right steps at the right time. But Matt Hancock did announce that target whilst he was under some pressure, and now clearly under some pressure to meet that within 7 days.
Not just testing, also tracing as well discussed today. A number of measures introduced to increase the effort of tracing.
Yeah, so recruiting 18,000 people to get a rigorous track and trace operation going. Now, that, Matt Hancock said, will be for when infections are falling. So it's something that is being worked on. But we've seen sort of track and trace operations going on in other countries. It seems to have been deemed by some scientists as something of a success. So finding those people who have tested positive to coronavirus, alerting those who they may have come across as a result, isolating cases. And of course, they've been developing an NHS app in order to communicate with people via their smartphones in order to alert them to this. So that's part of the operation as well. And as I say, I think the government trying to respond to what seemed to become a kind of consensus amongst certain scientists that testing was a very important part of tackling this virus, and as well an important part of trying to ensure there are ways to gradually lift the lockdown at some point. Although, of course, as we've been hearing over the last few days, the UK government in Westminster reluctant to spell out exactly how that might happen.
Jessica, as always, thanks so much for talking us through that. Jessica Parker there, our political correspondent, just bringing us up to date those new lines from the daily briefing in the UK. Now, also today, the first human trial of coronavirus vaccine in Europe got underway. It happened at the University of Oxford. Usually, vaccines take years to develop. This one, however, was fast-tracked. And here's one of the 500 participants, Lydia Guthrie.
There are risks that any participant might have an allergic reaction to the vaccine. There's a risk that they don't exactly know how it will operate in human subjects because of the urgency. Some of the usual animal testing steps have been skipped out so that this vaccine can be made more quickly. So the scientists and the whole team are really honest with us that they don't quite know exactly what the impact is going to be. But they have reassured us that this virus is built out of building blocks that are very well researched. So they don't have any reason to think that there will be particularly harmful side effects.
Lydia Guthrie there, one of the first participants to have that vaccine tested. Now, meanwhile, the New Zealand nurse who cared for the Prime Minister Boris Johnson while he was in intensive care has spoken to the media. Jenny McGee from Invercargill said that at first she thought that Mr Johnson's television shout-out to her was a joke.
There was a lot of media interest about him being in hospital, and to be honest, that's probably was the toughest thing of the lot. As a unit, he was just another patient that we were trying to do our best for, so it was business as usual.
So you weren't even a little bit nervous?
No, I honestly don't think I was. When I got in the car after work each night and I could hear things about Boris Johnson on the news, that was very surreal because I thought, wow, I've just been looking after him. But I really wasn't fazed by looking after Boris Johnson.
And what about in terms of ICU? Do you think they lowered the bar just to let him in because of who he is?
No, we take it very seriously who comes into intensive care. These patients who come into us, it's a very scary thing for them, so we don't take it lightly, and he absolutely needs to be there.
Talk to us about how he found out you were Jenny from New Zealand.
We just chatted away and it just naturally came up. He was interested in where I came from and what my story was. We spent a lot of time together in it. So, we talked away about New Zealand.
They certainly did spend a lot of time together. Of course, Jenny McGee, one of the 2 nurses who cared for the British Prime Minister while he was in intensive care. Now, the US House of Representatives is meeting to vote on another tranche of bailout funds as a further 4.4 million Americans lost their jobs. The latest unemployment numbers are stark. New applications for unemployment benefits mean that the total number of people who have lost their jobs since mid-March in the States is 26.4 million. Now, that is about 15% of the US workforce. And this graph shows the huge spike in unemployment, which happened very quickly as those lockdown measures brought the world's biggest economy to a standstill. And this graph is from the Economic Policy Institute, and this shows us the unemployment claims over the past 50 years. Now, the areas in grey indicate a recession, and what this graph in fact tells us is that the jobless claims of the last 5 weeks are more than 5 times worse than the 5-week period of the Great Recession. Puts it into context for you. It is really hard to comprehend these figures, the size of these figures. So let's get a little bit of context from the economist Elise Gould. She tweets, "How do we even understand a number like 24 million? It's as if the entire adult population of Texas and Oklahoma combined applied for unemployment insurance benefits in just the last 5 weeks." So let's get some context for this. We can speak to Heidi Stephens, who's a former chief economist at the Department of Labor, joins us live from Carmel Valley in California. We're talking about such huge figures. It's very important to remember that behind the stats are individuals, are people who have families who are really struggling. How does unemployment benefits, how do they work? How quickly will these individuals get the money that they need?
That's going to vary a lot across different states in this country. Our unemployment insurance program is actually administered at the state level. So there's more than 50 of these programs, and they have varying degrees of being ready to accommodate a crisis of this magnitude. So what we're seeing is, in many cases, people are getting frozen out. They're having to face long delays, which is a real problem. I hope the U.S. really learns the lesson that we need to invest more in these programs so that we're ready when a crisis like this hits, because this is the lifeline for working people who have lost their jobs through no fault of their own, through a global pandemic. And so it is a shame, I think, the fact that we've underinvested in these systems in recent decades. It's working people right now who are paying the price.
And it's working people, especially people who work in, say, the services industries, those people who serve food, for example, people who earn such a large amount of their salary through tips that will be hugely affected.
Yeah, so the industries that we're seeing being hit hardest right in the beginning of this crisis are those frontline service industries where there's a lot of social interactions that have been really shut down. So you're talking restaurants, hospitality industries, hotels, tourism, anything related to events. Brick and mortar retail has been hit really hard. So one of the underlying things about all those is many of those jobs are very low wage jobs. So you're seeing people seeing their jobs disappear who before that didn't have high enough wages in order to have a cushion built up. So people really are in dire straits and desperately need government relief at this point.
Heidi Stephens, thank you so much for talking us through those figures from the United States. A really difficult day for the States once again with those unemployment benefit figures coming through. Do stay with us here on Outside Source. We'll be looking at EU leaders who are discussing a massive coronavirus bailout within the EU as the European Central Bank warns the bloc's GDP could fall by 15%.